Washington designed to cover every aspect of the administration of Medicaid. And as someone who has audited Medicaid plans, I'm going to tell you right now, Medicaid cannot do these things, Medicaid cannot afford to do these things, and nobody can audit whether they are doing these things. This is typical impractical junk from bureaucrats who have absolutely zero real-world personal track record of any achievements at all. So it seems like maybe there might be a middle way with Medicaid. Don't crush it with regulation, but not give carte blanche to the states to do stuff that might be cheap-ass and harmful. It's probably a forlorn hope to ever get a centrist opinion on healthcare. I don't hear very many of them. Finally, I want to weigh in on an issue that hasn't gotten almost any airtime at all: the proposed elimination of the ban on lifetime limits. Wow, that's a mouthful. I know it's a double negative, and I'm going to come back to explain it, but I want to start off by saying, if I had been one of the people getting interviewed rather than the person doing the interviewing, that would have been my top concern. So why the double negative, and what's this all about? Well, before the Accountable Care Act, one of the ways insurance companies and self-insured large employers protected themselves against huge bills from chronically ill patients was to impose lifetime caps. So they'd say $5 million is the limit on what you can spend. That seems like a lot of money to most people, and it didn't get a lot of attention. But today, with all the high-tech meds and expensive drugs, you could easily spend $750,000 a year keeping yourself alive, where you would have died in a previous generation, with all these miracles. What happens to you? Well, with a lifetime cap, after 7 years, you lose your insurance. Even if you remain employed and your premium was paid religiously, you are now uninsured. I said something about this on Facebook, and a friend on Facebook who used to buy insurance for a large corporation, he defended the practice as cost savings and only affecting a small number of people. I pointed out that more than half of the people that file for personal bankruptcy in this country do because of unpaid health expenses. Much of that's going to continue because cost sharing is going to continue to soar. But even if it's only a very small number of people, if you aren't aware of how lifetime caps work, and let me repeat that, ACA, Obamacare prohibited it, and the Republican House bill would again allow lifetime caps. Let me share an example, a story. You have an 8-year-old who has hemophilia, and you have some medical bills, and a lot of it's cost sharing month in, month out as he gets his clotting factor. But one day, the doctors tell you he's developed something called an inhibitor. And this means going forward, he's going to need massive doses of fairly expensive clotting factor and some terribly expensive medicines perhaps as well. So what happens? Your insurance pays for a while until your kid hits $5 million, which in this scenario can happen in a 6-month period. And then you go on Medicaid, right? Sure, as soon as you become poor. So say bye-bye to your IRA, bye-bye to your nice house, bye-bye to any other savings, bye-bye to the money you saved up for college for him or any of your other children. What'd you do wrong? You had a kid that got sick. How can this practice be justified or tolerated in the name of cost savings? I think it's inhumane. The only reason anyone ever thinks about it, in my humble opinion, is because we still have this quasi-moral notion that illness is some form of divine punishment or moral failing. And even if you are a secular humanist, I have heard people say, well, if they weren't fat or sedentary or smokers or drinkers, they wouldn't be sick. And while that may be true, most of the very expensive people in this country got there without having any of that fun. The sad fact is that if you want to get poor in the United States, the quickest way is to get sick. The ban on lifetime caps is an essential for all of us to be concerned about. It probably will never affect us. But if we worry about other people and what's fair, it sure ain't fair. My other takeaway is that people need to chill just a tiny bit. No matter what the GOP says, the Accountable Care Act did not destroy our healthcare system. My experience has been that it has sucked for 20 years, and it really didn't change in the way it sucked with the passing of the Affordable Care Act. some things did change. Some people really didn't like those changes. Some folks finally had coverage, and for most, like me, nothing really changes. And I think something similar happens today with healthcare reform. Some people lose their coverage. Some people will be really happy with the changes. But most folks will see no change, except maybe to what they regard as a fair and compassionate society. But is this going to be medical Armageddon? I really doubt it. My old man used to always tell me, you never drink the soup as hot as you make it. I remember him sharing that with me in 1968 when Richard Nixon got elected and I was despondent. Nothing is ever as bad as one fears or as good as one hopes. I want to leave you with one last interview. To me, it outlines the difference between healthcare and health insurance, and in a very succinct way points out the relationship between money and health. And so your name is, and where are you from?
William from Brazil.
Okay, and so you're from Brazil, but do you live here now, or are you visiting?
25 years.
Okay, so the question we have for you today is all this stuff with healthcare reform. How do you think it's going to affect you?
Well, for sure we will affect. People don't make very much money. There's no way to go to the doctor. So I'm here for 25 years. I went once when I couldn't, hold the pain. So I had to go, and I think I still have to pay for that. That was like 20 years ago. So if I don't have the money to see a doctor, better not to get sick.
Stay healthy, my friends.
Be sure and subscribe to our podcast on iTunes and more details at grumpyolddoc.com.